Hola, muy buenas tardes a todos. Ya en unos segundos vamos a estar comenzando con
Hello, good
esta.
afternoon. We will be starting in a couple of minutes. Let's just stand by until everyone comes here connected to the platform. And once again, we remind you that you will be finding information, updated information on the disease on Paho's website, as well as guidance and also daily updates of the region and by country. Thank you.
Muy bien. Bueno, ahora sí, entonces.
So, good afternoon to all of you and welcome to this weekly briefing on COVID-19 in the region of the Americas. My name is Sebastián Oriel, and I am with the Communications Department here at Paho. This session will be about an hour long, and we will be accepting questions up to the end. And as you know, we have simultaneous interpretation into English and into Spanish. We have already received some questions via email, and you can also ask questions through the Q&A button at the bottom of the screen, and please ask your questions also live, but first write through the Q&A for us to be able to organize ourselves. And as usual, please include your name and the media outlet. This session will also be followed via social media, Facebook and Twitter. Today, Paho's director, Dr. Teresa Etienne, will be informing you about the current situation of the pandemic in the region, as well as the path forward. With her, we have Dr. Jarbas Barbosa, who is the assistant director, Mr. Ugarte, who is the director of health emergencies, Dr. Espinal, who is the director of communicable diseases, and Dr. Alighieri, who is also the deputy director for emergencies at Paho and also working on COVID-19. And now I would like to invite Dr. Etienne for her opening remarks.
Good afternoon, and thank you for joining today's briefing. Nearly half of all COVID-19 cases globally can be found in the Americas. As of June 23rd, there have been more than 4.5 million COVID-19 cases and 226,000 deaths reported in the region. And unfortunately, these figures continue to climb. Across Mesoamerica, the virus continues to circulate widely in almost all the countries. There is now widespread transmission in most of Central America. In South America this weekend, Brazil surpassed 1 million COVID-19 cases, joining the United States as the only other country in the world with cases in the 6 digits. The Caribbean is faring better, but with hot spots on the border of Haiti and the Dominican Republic, as well as within the Guyanese Shield. Last month, I announced here that our region had become the new epicenter of the pandemic. I'm sorry to say that since then, cases of COVID-19 in Latin America have now tripled from almost 690,000 May 23rd to more than 2 million today. Yesterday, we concluded a productive meeting of Paho's executive committee in which we took stock of the pandemic's toll in our region and looked ahead to the collective actions needed to overcome this crisis. While the recent increase in cases is extremely concerning, we have averted an even greater tragedy thanks to the early adoption of public health measures, which have helped protect health systems and save lives in many countries. But sustaining these measures has not been easy, particularly given their economic and social impact. Now, governments are under pressure to ease restrictions for economic and political reasons, even while transmission is increasing. In the absence of effective treatments or a widely available vaccine, we expect that over the next 2 years in the region of the Americas, we will experience recurring COVID-19 outbreaks, which may be interspersed with periods of limited transmission. We must be realistic about the future. All of us must adjust to a new way of life and redefine our sense of normal. The question is no longer, how do we go back to the way things were before? But rather, how do we move forward and build a sustainable and effective outbreak response? This week, our member states discussed a resolution that seeks to balance the triple threat this pandemic presents to the health of our people, to our social welfare, and to our national economies. Their recommendations are not only relevant to the crisis we face today, but also chart a course to navigate the next 24 months of the pandemic. In the face of a fast-changing pandemic, leadership will make or break our response. Now is the time for leaders to reach across political divisions and geographic borders to rally the support for a response that is commensurate to this unprecedented crisis. Each country will need to adjust and coordinate their COVID-19 response based on increasingly detailed data. Governments will have to make decisions considering simultaneously health, economic, and social indicators. This will allow health officials to understand where transmission is accelerating and which groups are at greater risk so as to better target their efforts. Flexibility will be key, and public health measures as well as social protection efforts will need to be reviewed regularly to minimize the impact of the virus in our societies. The provision of social, financial, and fiscal protection, especially in communities heavily dependent on informal economies, is critical. We will not overcome this crisis without addressing the needs of the most vulnerable, those most likely to fall sick and the least likely to receive care, such as Indigenous people, Afro-descendants, the urban poor, and migrant populations. If we neglect them, we run the risk of the next 2 years looking like the past few months. And this should not happen. To support effective decision-making, we will need timely and reliable data about the virus's spread within cities, throughout provinces, and across countries. This information is vital to help governments identify new outbreaks early and adapt responses in the face of changing scenarios. While an active risk of transmission remains, we must also prioritize early detection of suspect cases, laboratory testing, contact tracing, and quarantine as the foundation of a targeted and sustainable strategy to control COVID-19. This is now more important than ever. But ensuring this happens at the level and to the scale that our region needs will require investment in human resources, supplies, improving surveillance, as well as the development and rapid adoption of new tools. We must also continue to strengthen our health systems, which are our strongest defenses against COVID-19 today and well into the future. Paho's recommendation of public health expenditure benchmarks at least 6% of GDP. This is more relevant now more than ever. And a 30% investment from all public health investments that should be allocated to the first level of care. If we allocate resources to primary health clinics, hospitals, laboratories, and grow our health workforce, invest in essential public health, and expand our stockpiles and supplies, we can stay ahead of the pandemic and save lives. This will also lay the groundwork for the timely and equitable rollout of future vaccines and treatments. We must not forget that as challenging as things have become, this region has in the past made some of the most momentous achievements in public health. The elimination of smallpox, poliomyelitis, measles, rubella, and congenital rubella syndrome. These milestones were only attained thanks to coordinated responses to shared regional challenges, exactly what we need to tackle COVID-19 today. COVID-19 will only be defeated through concerted regional cooperation and action. Though we rejoice when one country successfully flattens its COVID-19 epidemic curve, the risk of re-emergence will always remain unless we flatten the curve regionally and globally. Paho is committed to continuing to serve the people of our region with the guidance and support they have long relied on to ensure that together we can defeat this common enemy. Thank you.
Muchas gracias, doctora Etienne. Vamos a comenzar
Thank you
ahora
very much, Dr. Etienne. And with that, we're now going to move to the questions that we have received via email, and then we're going to move to the questions that we have received via the first question says,
increased, particularly in Latin America. Many vulnerable groups are struggling to make ends meet amid this pandemic. What does Paho say to that? Dr. Etienne?
Thank you for that question and for focusing on our vulnerable populations. The truth is that for many populations in the region, implementing and adhering to public health measures has been challenging. Workers from the informal economy, families living in overcrowded houses, indigenous and Afro-descendant populations living in precarious conditions, and those without access to soap and running water are particularly at risk. This is why it is so important for countries to implement policies and programs that address the issues faced by these vulnerable populations. The COVID-19 pandemic has demonstrated how the most vulnerable in our societies are disproportionately impacted by disease. Countries must put in place now and in the medium to long term programs to increase social protection and to reduce inequities and disparities across all sectors. Thank you.
Gracias, doctora Etienne. La siguiente pregunta viene
Thank you,
de...
Dr. Etienne. The next question is from Ariadna Ortega from the Expansion Group in Mexico. The question is, what is being done or what must countries do to have access to the vaccine when it becomes available? How can we ensure that the countries in the Americas or developing countries will have access to them? Dr. Barbosa, thank you for that question, Ariadna. The COVID-19 vaccine is a hope that we all have. I believe that a lot of academic institutions, public institutions, private companies, etc., are working very hard to find a vaccine for COVID-19. We have about 130, 10 of which are already in the testing phase and the clinical trials phase. But it's very important for countries in the region to
rather than preparing for countries to prepare for an upcoming vaccine. At Paho, we are working with the countries in the region to train the regulatory agencies in the region in how they must prepare for a future COVID-19 vaccine and how we can have more countries in our region participate in these clinical trials that are being done. And for that, we need to have the ethical, regulatory, and technical capabilities in the different countries. We're also actively participating in the global mechanism to access COVID-19 vaccine with other partners such as WHO and Gavi and Paho, with over 30 years of experience with its vaccine Rotary Fund to participate as a bloc so that each one of our countries can have access to a future vaccine. This is a huge challenge that we have so that all the countries, not just the rich ones, can benefit from the vaccine. So we are very actively involved in this and we are providing support to the countries in the region.
La próxima pregunta llega
The
de Fernando
next
Melis
question is from
desde el
Fernando
mundo
Melis
de
from
Brasil.
r7.com in
Dice,
Brazil.
Brasil se
And it
encuentra entre
says
los países
Brazil
sudamericanos
is one of
que
the South
menos
American
realizan
countries
pruebas de
that
COVID-19.
are
¿Cuál es
doing
la
the least
evaluación
numbers
que hace
of
la OMS
COVID-19
del programa de
testing.
pruebas en
How
Brasil y cómo
is what
mejorarlo?
is Pajo's
La OPS
assessment
tiene
of
recursos para la
Brazil's
compra de
testing program,
kits. Doctor
and how can
Espinal.
we improve it because we do have resources to purchase testing kits? Dr. Espinal, thank you very much for the question. Yes, in fact, Brazil is a country with a lot of resources that could increase its testing. Over the past few weeks, Brazil has made progress in increasing testing, PCR testing that is for COVID-19, but it's not getting quite to 10,000 tests per million people. So they need to ramp it up. So, but then we need to take a look at a state by state level because Brazil is a very large country with different population densities. For example, the states of Sao Paulo and Rio are the ones that have the largest number of testing being performed today. Sao Paulo with over 350,000. However, when we take a look at the number of testing in light of the population density, Sao Paulo, Rio, for example, are way below others such as Roraima and less populated states that have high testing capabilities per 1 million inhabitants. So it's important to not generalize, but the message is that we need to have them increase the number of testing in Brazil because that's going to give us an idea of how the different states are doing and the true number of cases as well as where we can help. Testing is very important for decision makers to make quick decisions for the benefit of the Brazilian population. Thank you very much.
Gracias, doctor.
Thank
Siguiente
you,
pregunta
doctor.
viene
The next
de
question
Ana Cruz del
comes from Ana
Confidencial
Cruz
y
from El
también de Lidia
Confidencial,
López de La
as well as
Prensa,
Lidia
ambas de
Lopez from La
Nicaragua.
Prensa, both from
Ana
Nicaragua.
dice, ¿qué
Ana
información
says,
tienen sobre el
what
número de
information do
pruebas que
you
se están
have regarding the
realizando en
number of
Nicaragua?
tests being
Me
performed
gustaría
in
que nos
Nicaragua?
indiquen las pruebas que
I
son
would like for you
recomendadas
to
por
see
la
what
OPS,
tests
ya que
PAHO
Nicaragua se han
recommends because
calificado las pruebas rápidas
Nicaragua
para
has ruled out
COVID-19.
rapid testing to
Y
detect
Lidia López
COVID-19.
dice,
And
¿qué
Lidia
evaluación
Lopez
le
says,
da la
what
OPS
kind
a
of
los
assessment can
reportes
PAHO
cuando la organización ha
make on
advertido de un
reports
aumento
when
de
the
casos en la
organization
región,
has
precisamente
raised
en la
its
frontera
flag
de Costa
regarding
Rica
the
y
increase
Nicaragua?
in
Y el
cases
Ministerio en
in
su
the region,
último
specifically in the
reporte el
border between
martes
Costa Rica and
registró una
Nicaragua?
bajada en los
And
casos
last
de
Tuesday, there
contagio.
was a decrease in the number
Doctor
of
Ugarte.
infections. Dr. Ugarte? PAHO provided support to train lab workforce at the national benchmark diagnostic lab in Nicaragua. However, it has not received information on the number of tests performed and processed by the national lab. I'm talking about for confirmed COVID-19 cases. The WHO provided specific recommendations regarding the type of test to diagnose the disease and the clinical moment when these tests will be more accurate to confirm the presence of the SARS-CoV-2 virus. In this case, even though the rapid test, that the ones that detect antibodies in blood, may determine whether or not the person has been in contact with the virus, we cannot identify when that contact took place. Also, we don't have enough evidence to say that the bodies that are present in blood may provide protection or for how long they can provide protection. Therefore, rapid tests should not be used as the sole diagnosis tool, but rather for research purposes or to determine zero prevalence in any given population. There is a significant increase in cases on the Costa Rican side of the border with Nicaragua, and what we would expect is to have an increase in cases in Nicaragua. So we are just waiting for that information to be shared by Nicaragua, taking into account the geographic area where cases are reported. But as of now, we have not received that information. Thank you.
Gracias, doctor.
Thank you,
La
doctor.
siguiente pregunta viene de
The
Lara
next question
Pinheiro
comes from
from El
Lara
Globo
Pinheiro
Brasil.
from El Globo
Dice,
in Brazil.
the recovery trials in the UK showed benefits in the use of dexamethasone for severe cases of COVID-19. Would Paho like to comment on this? Is this good news for the region? Dr. Aldigueri?
Thank you for this question. Yes, this is good news. The preliminary report of the recovery study in the UK has shown a reduction in 1/3 of mortality in 1/3 in patients on ventilators, I mean in intensive care units, and of 1/5 in patients under oxygen. The good news is also that dexamethasone is medication that is on the list of essential medicines, the WHO list for essential medicines, for more than 4 decades. This is a cheap medication. It's widely available. So WHO is aware of other ongoing studies, including dexamethasone, and is planning to do a meta-analysis of the results, including preliminary results of these other studies. And WHO and the Pan American Health Organization are planning to update their clinical management guidelines with this new data. What we know from the recovery study, this medication, dexamethasone, is not for prophylaxis of COVID-19. It is not for mild cases of COVID-19. It is for patients with severe COVID, severe disease, including, and I repeat, it's important, patients on ventilators and patients receiving oxygen in hospital settings. Thank you.
Gracias, doctor. Ahora quisiera darle la palabra para que haga su
Thank you,
pregunta.
doctor. And I would now give the floor to Robert Moore from La Vanguardia in Spain. And from Argentina, Robert, can you hear us? Robert, if you can hear us, you have the floor.
Buenas tardes, ¿qué tal?
Good afternoon. Yes, I wanted to ask Dr. Etienne about your opinion about the European Union opening its borders as of July 1st, and countries such as Spain and Italy are hoping to increase their economic activities through tourism, although they were some of the most severely affected countries at the global level. The Union has not yet decided whether they will ban entrance of visitors coming from certain countries. I would like to know Paho's opinion in this regard and whether you believe that reopening flights between the Americas and Europe could result in a massive rebound of COVID-19 cases. Thank you. Now, Dr. Ugarte will address the issue of borders. Go ahead. Thank you very much, Robert. The current recommendations from WHO regarding international flights that are non essential are included in a document that's called Temporary Recommendations, which were issued May 1st, pursuant to the international health regulations. And the decision to reopen international traffic for non essential activities is up to each individual country. However, PAHO and WHO are working on a document that will be published briefly that detail the considerations that should be taken into account before reopening non-essential international travel, especially in light of spikes in cases in several countries. We are seeing that countries that had previously had the disease under control can have outbreaks in their own countries, and they could even see a second peak in the disease, sometimes higher than the previous one in as part of this first wave. The main items that the document will include is that, first of all, there's no such thing as zero risk. There's always some kind of risk, and the decision must be made from the point of view of managing that risk. And at this point, there are no tools whatsoever, be it diagnostic or epidemiological filters or screening that would enable us to decide who are in a position to board a plane and who is not. The third aspect is that the main aspects that national authorities should take into account when assessing the when, how, and from and to where to reopen international routes, because this will depend on several aspects, but mainly it will depend on the country's capabilities to manage the travel flows and how they're going to follow up on those travelers once they get to the countries. The other aspect has to do with monitoring imported cases, because I'm sure those will come up. And when looking for imported cases, oftentimes it's done much more exhaustively than looking for internal or domestic cases. And that's a lesson to be learned by all of us. Oftentimes, when talking about borders and migrants in general, a lot of emphasis is put on international travelers and migrants, whereas where the case most of the cases appear within the country, and that's a lesson that we should learn once and for all. There's a very important aspect that has to do with assessing each country's dynamics as to and from where they could have flights, for example, non-stop flights, because you can see that several countries are adopting very restrictive measures, but at the same time, they're opening up their economies. So at this time, a dynamic and controlled step by step decision with surveillance, with health services, and with measures that are tailored to a reality is the way to go. And I'm sure that's the recommendation that you will see on the document that will be published. Thank you.
Thank you very much. And also, as a follow up to that question, we have a consultation from Roston Ed Witness, senior reporter in Bahamas, and this is similar. It is also related to the Caribbean in particular, and it says that on July 1st, Bahamas is opening up its borders to travelers to Russia, the US, and Brazil. And the question is,
requirement for entry act as a sufficient safeguard as the Bahamas has done?
Well, as you know, the test is, if it is negative or if it is positive, it is something that is related to the moment that the test was taken. So, and there are many cases that the people will be asymptomatic and the test may be negative. So if the person is take the test, let's say 1 week before traveling, and they go to the country, they may still have the disease. So this is one of the criteria that is being evaluated, and we'll need to look at that very carefully, considering especially that all the filters and the screenings at the borders, both at the points of entry, but also at the exit borders, have not been successful during this pandemic and any other pandemic, by the way. Thank you.
Gracias. Siguiente pregunta, me gustaría darle.
Thank you. This is another question, and I would like to offer Alina Diester from AFP the opportunity to ask this question live. Alina, you have the mic.
Hola, ¿se escucha?
Can you hear me? Yes,
Sí,
we can
buenas
hear
tardes.
you. Good afternoon.
Quería saber en relación a los
I
casos
would
de
like to
dengue que
know
se han
in connection
reportado,
with the
también de
dengue
chikungunya y de
cases
Zika,
and
si están
chikungunya
notando una
and Zika
concurrencia
cases,
de esas
whether you see
infecciones
some
con
sort of concurrence
COVID-19 y
among
cómo
these
afecta el
infections and
control de esas enfermedades
COVID-19 and how the
epidémicas el que
control of
estemos en
these
medio de una pandemia.
epidemic
Y por otra
diseases
parte, me
is
gustaría
impacted
saber
by the fact
sobre
that
la
we are in the
malaria,
midst
que
of
también
a
impacta en la
pandemic,
región,
and
qué cifras tienen y
like
si
to
han
ask you
detectado un aumento de
about
los casos.
malaria, whether you have new figures and whether you have seen an increase of cases. Thank you, Alina. Dr. Espinal, could you please address this question? Yes, thank you very much, Alina. The truth of the matter is that any pandemic or outbreak does have an impact on the follow-up that we give to other health problems. Therefore, Paho has always called upon our member countries and regional governments to protect those priority programs and also those programs where we see gains, not only in the area of dengue and malaria, but also immunization for TB and HIV. So we should not be distracted. We should pay attention to COVID, but also to the other diseases because they do not wait. Diseases do not wait. Now, as to dengue, we have seen, and as you properly indicated, we have seen this in 1.6 million cases, but we also saw a decrease in the southern cone, not in other areas, but this could also be due to several reasons. For example, they just concluded summer, but also many of our workers have to move to work during the pandemic. So this could also be due to the fact that since we have social distancing and we have quarantine, mosquitoes do not circulate freely and they also have fewer opportunities to bite. We need to remember that the dengue mosquito is a daytime mosquito as opposed to malaria, where we have a nighttime mosquito. So what we have seen with malaria is that there has been a decrease in connection with vis-a-vis the same period last year. But at this time last year, there was an important, significant increase in Venezuela, but now there has been a decrease of malaria cases in Venezuela. But this may be due to several factors, as I just mentioned. But we have also seen a decrease in Brazil and in other countries in the region. But also, paradoxically, we have seen other increases that are focused in other countries. The message is to protect the gains and also to protect programs to invest in health, as Madam Director just mentioned, because the diseases are not going to wait for COVID to disappear. So we need to bear this in mind. And Paho has also published the press note on dengue, chikungunya, and Zika this week to be able to alert countries that these diseases continue to be epidemic and that due attention needs to be paid to them. Thank you very much. Thank you, Doctor. Now, the following question we have is from Angeline Montoya from Le Monde. Some questions have also decreed an early quarantine when there were only few cases. Hasn't this been negative as we look at this throughout time? Dr. Barbosa, could you please address this question? Yes. All of the evidence shows that the countries that implemented social distancing measures late had a very significant increase of cases, as we saw in northern Italy and also here in New York and Guayaquil, Ecuador. Therefore, social distancing measures need to be implemented early during the transmission so that they do have the impact of preventing a rapid transmission that could have a high number of acute cases that could overwhelm the capacity of the ICUs, hospitals, and other treatment centers. In Latin America, in several countries, those measures were adopted, and as a result, transmission was delayed or the rate of transmission was decreased. We have a mosaic of situations in those countries and among countries, and also within the countries themselves, various states and provinces that have situations that are more in control than in other provinces and states that do have significant transmission. So I think that at this point in time, in connection with transmission, since we see increases, we need to determine the causes for the social distancing measures and what we can do to adopt measures that could be more effective, what could be done to increase social protection, social welfare for people, and also how to protect poor families so that social distancing measures may be as effective as possible and decrease transmission and also save lives, which is the main goal they have. Thank you. Thank you, Dr. Barbosa. Now we have Linda Stryker from Granada. Question.
In particular, the subregion of the OECS has recorded the least number of cases and deaths, and some find it unfair that there is no distinction as to the difference between CARICOM bloc and South Latin America. Can you explain why the CARICOM bloc must be included in the Latin America data? Dr. Aldigueri?
Thank you for this question. It's a very good point regarding how to reflect the situation in subregions, including in the Caribbean community. We have different sets of countries as in the Caribbean. First, we have Caribbean-wide, including Caribbean mainland countries and other islands, French-speaking islands. So in this Caribbean-wide group of countries, we have an accumulated data of more than 47,000 cases reported to Paho during the last month. This includes Haiti, the Dominican Republic, Puerto Rico, and French Guiana. Within this big block of Caribbean countries, both islands and mainland countries, we have a block of countries of the CARICOM, of the Caribbean community. And in these countries, we have a report of 1,650 cases as of yesterday, as of 22nd of June. Within this CARICOM community reports, we have a subset of reports, including the countries of the Organization of Eastern Caribbean States, including Antigua, St. Kitts and Nevis, Antigua and Barbuda, St. Kitts and Nevis, Dominica, St. Lucia, St. Vincent and the Grenadines, and Grenada. And for these countries, we have a total report accumulated of 140 countries. In some of these countries, we have no cases reported from 6 days ago to 65 days ago. So you see really the three big blocks of in the Caribbean. However, what I would like to flag in countries that have reached excellent results with implementation of very strict public health measures and social distancing is that when the adjustment will be made, including with opening the airspace, there is a high risk of importation of cases in these countries and to trigger again a transmission on within the country. So really, we, as other of my colleagues during this press conference, we would like to flag the importance of the planning and organization of the adjustments of the travel-related restrictions, including with a very strict surveillance and including with contact tracing capacities in place for controlling any importation of cases when the country would resume some level of international connection. Thank you.
Gracias, doctor. La siguiente pregunta viene de
Thank you, doctor. Now we have the next question by Matias Onewi from Medscape in Spanish. As the lockdown and social distancing measures continue, do you think that depression, anger, anguish are factors that could go against the fulfillment of these measures, Dr. Espinal? Thank you very much for the question. It is a very important question related to what we have already mentioned as to the need to strengthen and to facilitate access to services that offer guidance and mental health, because during quarantine, when we need to spend time within the confines of the home and kids cannot go out to play, these situations may be a vehicle to give room to give way to anxiety, depression, and situations that make us upset. And that is likely. It is normal for this to happen, but we need to have access to those services and also the recommendations, and also visit websites of organizations such as WHO's and Paho's, where they will find recommendations to facilitate management of the situation. And also, it is important not to read all of the news. That also triggers anxiety. They should read a book, have a video conference with family members to take a break from work, to have some sort of entertainment. This could happen, yes, but it is also important to remain calm, because if we become upset, we may also go into more serious mistakes. And Paho has also called upon the countries to guarantee that guidance and also access to health workers, psychologists, psychiatrists, and also social workers who have experience, who can also help and guide our populations. Thank you very much. Thank you, doctor. The next question comes from Bloomberg by Sebastian Boy and Andrew Rosati in the chat, and it reads,
what's going on in the southern and southwestern US states like Arizona that have been steep spikes in cases, but so far without a corresponding rise in deaths? What are possible explanations? Doctor Barbosa puede tomar esta pregunta.
Thank you for the question. The US, we see the similar situation that you see in many other countries in the Americas. It's a vast country, so we have many different epidemiological situations. We can see clearly that in New York, that was the epicenter of COVID-19 many weeks ago. Now the situation there, the transmission is controlled, and they are starting opening the economy in a very well-planned way. In other states in the United States, we are seeing the states that you mentioned, uh, Florida, Arizona, and other states, we are seeing an increase in the number of cases. Of course, that this called the attention of the governors of these states about what public health measures need to be adopted, what are the effective measures to reduce the speed of the transmission. At the same time, when you have a situation like you described, that the number of cases are increasing and the number of deaths is not increasing, maybe this is a good sign of that the access to PCR tests is increasing in the community. But I think that is better safe in this, the better safety option in this case is to monitor very carefully what is happening, and if the transmission is increasing, if you are experimenting an increase in the number of cases, public health measures need to be adopted, and public health measures that have already been very well proved to slow the transmission. So this is a situation that probably we will see in the next weeks and months, maybe. They need to monitor because in no place is safe. If the transmission starts, you need to adopt the prompt measures to reduce the speed. This is the way that we see the near future for us. Thank you.
Gracias, doctor. La siguiente
Thank
pregunta.
you. Thank you, Doctor. The next question is from Daniel Collins from TN23 in Guatemala. The question is, how does Paho read the situation in Guatemala, the level of infections and deaths that have increased significantly? Dr. Ugarte, could you answer this question, please? Thank you. Well, the situation in several countries, Guatemala being one of them, is that there's been an increase in cases. We understand that several adjustments are being made, not only in terms of information management and follow up on cases, but also restructuring health services, as well as distribution of personal protective equipment. We believe that those measures are highly timely in helping control the epidemic. So we will see scenarios such as what we see in Guatemala and other countries as well, by the way. However, these adjustments that have been made lately have support from the organization at all levels, and we hope that they will be successful. Thank you.
Gracias. Siguiente pregunta
Thank
es
you.
de
Next
Luis
question,
Madrigal,
Luis Madrigal from
Producer de Costa Rica.
Delfino.cr
Dice que países
Costa
latinoamericanos
Rica.
están
It
viendo
says Central American
creciente
countries are seeing
positividad en
increase
pruebas
in
de COVID.
numbers of positive
Ayer
COVID tests.
Guatemala registró una
Yesterday,
positividad del
Guatemala
70%, pero
saw a
Costa Rica
70%
está casi
positive
por
rate,
encima
and
del
Costa Rica
10%
is above
recomendado por la
the
OMS.
10% recommended
¿Tiene
by
datos y
WHO.
reportes de
Does
capacidad
PAHO
reducida
have
de testeo en
reports
países
on
por
reduced
falta
testing
de equipos
capabilities in the
o
region due
equipos?
to lack
¿Hay
of
casos
resources or
excepcionales en donde
equipment?
una
Are
positividad del
there
10%
exceptional
podría
cases
no
where
ser
this 10%
significativa
positive rate may
para
not be
alarmarse?
as a
El
red
doctor
flag?
Aldigueri podría tomar esta pregunta.
Dr. Aldighieri, could you please answer this question? Of
Gracias por estas
course, and
preguntas.
thank you for those questions.
En América Central, todos los
In Central
países
America,
tienen
all
tendencias
countries
crecientes,
have
con la excepción de Belice, que todavía está en
it has seen
fase
increases with the
cero,
exception of
con
Belize,
casos esporádicos.
where there's still sporadic
En
cases.
todos los países de América
All
Central
countries in Central America
existe la capacidad de
have
realizar pruebas moleculares PCR con
the
el personal
capabilities to
entrenado
perform molecular
y
PCR
laboratorios
testing.
equipados
They do
para
have trained
procesar las
staff
pruebas.
and labs that are equipped
Eh,
to process
y en
the tests. And the majority of Central American countries have decentralized a lab to other departments or neighborhoods or cities. All countries in Central America report their data on a daily basis, with one exception, which is Nicaragua. With good identification of clinical cases or catchment of clinical cases and an increase in, in positive cases indicates that there is an increase in cases as part of the epidemic. A 10 to 20% increase is an indicator that shows that transmissions are indeed increasing. 70%, a 70% rate may reflect a need to broaden the lab network to the primary care level, because these 70% rates show that that cases are concentrated in hospital settings. But at this point, Central America has all of their lab capabilities, and Paho started back in February, had started providing training uh, remotely during the international travel ban. We still provided help to labs, and it continues to provide the national lab networks with all of the equipment that they need to perform the molecular testing. Thank you. Thank you, doctor. And the next question is from Isabela Gonzalez from Reforma in Mexico. The question is, I would like to know whether Pajo thinks that Mexico has managed to flatten the epidemiological curve in the country. Dr. Barbosa, could you answer? Thank you for the question. Mexico's situation is very similar to what happens in Peru, Brazil, or Chile. That is to say, it went through an increase in number of cases, and I'm sure that Mexico has certain things that make it different by state. Again, it's very important not to take the country average as that being the norm in every single province, but when we take Mexico as a country, over the past few weeks, we have seen a very evident increase in number of cases. And Mexico's health authorities have support from the Pan American Health Organization to review all of their data to see what other measures could be taken or whether they can make social distancing more effective and provide health services uh, in order to quickly and effectively control transmission. Thank you. Thank you, doctor. The next question is from Mariana Souquet from Efecto Cocuyo in Venezuela. And it says, 2 weeks have gone by since the agreement to decentralize molecular testing happened in Venezuela. Has there been any progress in this regard? Has any progress been made in any other uh, aspects of the agreement, Dr. Ugarte? Well, we have identified labs where testing can be done in Zulia and other labs, and we were able to identify the safety and quality conditions both for the equipment as well as the facilities and training of their staff. On the other hand, we have held more meetings where we identified the supplies that are pressing and we prioritized those supplies. We have also discussed the new treatment protocols that need to be in place, and we saw what kind of availability exists right now or what could become available soon to be given to hospitals. We also made a decision to monitor the availability of PPE in certain specific hospitals and at the same time ensure that those PPE will be made available to the staff as a whole. That's it. Thank you. Thank you, doctor. And we are nearing the end of our session. So one final question from Matt Rivers from CNN. And the question
About the reopening and what risks does reopening bring? Dr. Etienne?
Thank you for this question. So from the 2nd of March 2020 onward, all but one of the 35 member states, with the exception of Nicaragua, adopted community-wide measures to restrict population movement. These were initially successful in slowing transmission, but within just a few weeks, questions arose as to the social and economic sustainability of these measures. So these concerns, compounded by a false sense of having brought the pandemic under control, have led some countries to start relaxing the measures. We have reiterated that a whole of government and a whole of society approach is required to strike a balance between public health and socioeconomic priorities and interests. Let's face it, the Americas is not one country, one city, or one town. We are facing what we have described as a mosaic of scenarios, even within countries. So this means that countries must exercise flexibility in adjusting measures in either direction, either in the tightening or the relaxing of them. And that should depend on the transmission scenario and the health, economic, and sociological data that is available. For example, in countries that are highly dependent on tourism, resuming non-essential international travel by air and sea will involve the implementation of measures at points of entry and in the hospitality industry itself. These measures must be taken based on global, regional, and national scientific evidence, as well as the capacity of the national health system. To facilitate critical decision-making processes, countries need real-time information on key health services indicators, for example, available bed capacities. And they should also have a system in place for the early detection of suspected cases, testing, isolation, contact tracing, and quarantine. I think we need to reiterate, they will need stronger health services with access for all vulnerable groups without the need for out-of-pocket payment or even worse, payment at the point of service. I think we need to reemphasize that going forward, countries must commit to invest in health. They need to commit at least 6% of their GDP, and they need to ensure that at least 30% of the public health investment is allocated to the first level of care and to essential public health functions. We must not be caught in this situation again. Thank you very much.
Muchas gracias, doctora Etienne, y a todos.
Thank you very much, Dr. Etienne, for all of our speakers and for all of you to be part of the session. In a few minutes, we will be giving you the opening remarks and as well as a recording of the session, and you can be in touch with us through the via email, and we will try to answer questions as quickly as possible. Next week, we will resume our Tuesday 11 a.m. Washington, D.C. time. So we hope to see you on Tuesday, and you will receive our email inviting you to that session. Once again, thank you very much for connecting to the session, and we hope to see you next week. Thanks.